We saw that the vast majority of these deaths amongst these youth are happening in the most vulnerable communities.
A new study involving UW-Medicine trauma surgeon Deepika Nehra takes a rigorous look into the troubling issue of child and teen deaths from violent shooting injuries.
What's particularly troubling is that over the last several years, firearm related injuries are the number one cause of death amongst children and adolescents. So if you look at 1 to 24-year-olds, they're the number one cause of death in the United States. What I think this study is drawing attention to is that, yes, firearm legislation is absolutely important and critical and does save lives. But even with that, we're going to need more. We're going to really need to focus, I think, in a real in-depth and sort of long-term way on communities that are disadvantaged in order to sort of build up the health of those communities so that we start really moving the needle with regards to firearm-related deaths, at least for youth, which is the population that we studied here. Even with stricter gun laws in place, there was a significant difference with regards to where youth were dying, meaning that there was approximately a 12-fold higher death rate for youth that lived in the most disadvantaged communities compared to the least disadvantaged communities. We actually saw that same relationship if you looked at places that had less strict or more permissive gun laws. There was an approximately 10-fold difference between the firearm-related death rate for youth in the most disadvantaged compared to the least disadvantaged communities.